Hello everyone! So it is freezing here in Indianapolis with a whopping high of 5 degrees. So we are having tea time with Aron McNicholas today and my dog Bodhi, who you will hear walking around. But today I wanted to talk about something with Aron that is just so important, and I don't feel like a lot of people understand that there are so many more options, holistic, whole mind, body, spirit, whole person approaches to dealing with cancer. And it's really irritating that people don't understand that they have other options and that there are so many better ways to help take care of yourself if you find yourself battling any of these really scary diagnoses. So this is one of my best friends, like my little brother from another mother. But we travel together and we study together herbalism, and he's a clinical herbalist, a functional medicine practitioner, and he specializes in oncology. And that's it. So I'm going to let him tell you all about it.
Yeah, I think when it comes to such a scary diagnosis like cancer, it's really quick to kind of rush into conventional treatments, and we're definitely not advocating to ignore your doctor or anything like that. There are times and places for surgery or immunological therapies, and so kind of navigating that scene with someone as an aide, I think is a really important part of that. And I usually tell people the most important thing is that, it's most often the case that you don't need to rush into something. You usually have a little bit of time. Some diagnoses you might have to move pretty fast, but yeah, you usually have time to think about a good strategy, and I think it's wonderful to choose integrative options, no matter if you choose to do chemo or radiation, or if you want to maybe just try alternative things as the sole treatment strategy. I think it's good to kind of come up with a plan and work with someone. And I think one of the best things for that is mistletoe.
Yeah. Okay, I've heard a lot about mistletoe through you, but I've heard about mistletoe even before Aron studied mistletoe. So I get a lot of calls at the apothecary asking me if I can help people with their new cancer diagnosis. Absolutely not. I'm not trained in that. That is not my area at all. So I refer them to Aron. And I think a lot of, like you said, a lot of people are so fear driven, but in a way it almost seems like the medical community is too. It's almost like they're fear driven, and so then all that fear is placed onto the patient at that time, where I feel like people that I know that you've worked with, you've really helped them. You've helped them with that fear by giving them a deeper understanding of how you can support integrative therapies.
Yeah, I mean, if we look at like cancer, I mean, we had Nixon declare the war on cancer, right? We think war, what does that mean? And we're like we're going to go against something. And I mean, records of cancer can be traced back to like ancient Egyptian medical texts. So it's a disease that's been around for a long, long time. And you'd think in that time period that we'd have come up with stuff that might support this, right? In that long history. But I think we've really gone askew lately with, like a war on something. It's kind of like saying I'm going to have a war with myself, right? And so I think we need to kind of realize that cancer is almost telling us it's a signal that something's gone awry, whether that's maybe there's a trauma or there's something in our terrain that's been altered, and that we kind of just need to bring, and this is kind of the theory behind mistletoe, is warmth, a mantle of warmth to that. Whether that's immunologically, bringing immune stimulation to that area. Some people might have heard like the fever response that sometimes it doesn't always happen, but sometimes happens with mistletoe therapy. But also warmth in the sense of, if there's a trauma that maybe was at the root cause of why someone got that diagnosis, that you bring warmth and understanding to that as well. So if you choose to use mistletoe as part of your cancer strategy, it's working more on that etheric body as well as your immunological body too.
Do you do other things while they're using mistletoe?
Yeah, that's the great thing about mistletoe. It's very synergistic. So I mean, we can talk about lots of great herbs, that can be incorporated, or dietary regimens. There's IV treatments. If people are on chemo, you just got to kind of work around that during certain times, whether or not you can use the mistletoe. So yeah, it's very synergistic with lots of other modalities as well.
Okay. What other like plant therapies or herbal therapies do you work with?
Yeah, one of my like staples I feel like I usually recommend to lots of folks are medicinal mushrooms.
Yeah. And he forages them.
Yeah, I was just up in the UP getting chaga and bringing that back. That was a fun trip, and yeah, it's fun to incorporate that as a daily, infusion that they can drink, as a tincture that they take. You kind of figure out what works best for them and what maybe is specific to the cancer. But no, it's a lot of plant medicine, and that's the great thing is if you're going to do surgery, you can do a lot of things to prep before the surgery, get your inflammatory markers down. You can run lab work to see kind of also predictive aspects of cancer. You can kind of see there's 3 markers, they call them the trifecta. And there are 3 markers you kind of look at to see if you are even at risk for cancer or it's kind of in a microenvironment that's supportive of that cancer environment. And it's almost more predictive than actually going in and getting a biopsy sometimes. And sometimes, if you have surgery that can kind of stir things up, sometimes it is necessary, but it can stir things up. And so, yeah, having someone that knows, what are the pros and cons of these different treatments. It's like having a toolbox, right? What do I pull out of my toolbox to kind of meet the needs of the situation?
Absolutely. And Aron is also very much an environmentalist. So he really also is amazing with understanding what is in our environment that are carcinogens, whether it's the water you're drinking, the pesticide-laden foods, the genetically engineered foods, just the high levels of glyphosate. So he's amazing at being able to help you understand these things as a part of your therapy also.
Yeah, we have so many environmental toxins nowadays, right? It's hard to avoid that as a human being, and so I think we got to kind of have these detox strategies in mind and eat clean diets. We're both big fans of Weston A. Price, and I think there's some great dietary aspects that can be incorporated in. I think clean water is the paramount to lots of cancer support. One of my favorite doctors to listen to is Dr. Tom Cowan, and he very much thinks water has a huge influence, and that a lot of these strategies, whether they're plant medicine or mistletoe, they're helping to just structure the water, the cytoplasm in our body. And that's really what cancer is a cytoplasmic water disruption. And he even goes into how he believes Steiner, with his mistletoe, was actually structuring the water in our body. That etheric life is kind of referred to as the water.
Makes sense.
And I think if folks have heard of mistletoe and they're really wanting to dive into it, I'd encourage them to talk to their provider, because just like if you go see an herbalist, a naturopath, a doctor, you kind of want to know what their background experience is, right? And not saying this to sound egotistical or I'm better than anyone, but you really want to make sure you go through a training with an organization for this.
Oh, you mean read a book and then all of a sudden you know what you're doing?
Yes. And unfortunately, there's a lot of providers that are just prescribing out of a book they've read. I've gone to train with the Anthroposophical Society, and they're kind of an organization here in the States that's kind of, I guess, paramount in establishing a presence around this therapy here in the U.S. It's mainstream in Europe. And so they've kind of partnered with some doctors in Europe and brought more resources over here. So I'd ask your provider, have you gone and trained with an Anthroposophical Society or other organization? Because they make you do months of prep work, courses, then you go through a 4-day actual course. You usually have a mentor too that you reach out to and discuss things with. And they go into the nuances of how you prescribe lots of the different host trees. There's tons of different host trees you can pick. Rather than what most people do is they just get the cheapest one or what's most available, and that's what they use. So yeah, ask your provider. There's not many of us. I think I'm the one person here in Indiana. Next closest is Wisconsin. Okay. And there's a great doctor in Atlanta that I often refer people to. So there's people around, and I think as we get more and more into this, we'll get more providers, hopefully. And we'll get people who really want to dive deep into getting personal with characterizing a strategy going forward with that unique person. And I've studied a bit with Chantal Cabrera.
Yeah, she's cool.
She's got a great course that she just did on holistic approaches to cancer. But like most herbalists, numerous self-studied books, and I've done a lot of reading on like Tom Cowan, who I mentioned earlier, and so I'd say that Chantal and the Anthroposophical Society have been two of my biggest inspirations. Donnie Yance has some great course material too that's been helpful. Kind of compiled all that together, and I'm still learning. I think that's the big thing.
You never stop.
Yeah.
Never. Not in this field.
No, and I think the clients that I see teach me more than anything else. So it's great to get to work with them.
Absolutely. So I noticed you have some books over here.
Yes.
So what are these?
Yeah, so if people are interested in learning more, the book Mistletoe and the Emerging Future of Integrative Oncology is written by the doctors who are really kind of pushing the envelope and educating, and they're with the Anthroposophical Society on mistletoe. And so they wrote a great book to kind of learn a little bit more. It's a great introductory material if you're interested in this field, if you're a patient, if you're a provider, either one, and kind of gives you a good solid foundation of the history and options available to you.
Okay.
So I definitely recommend folks check that out. And then one of my favorites is by Dr. Tom Cowan. It's called Cancer and the New Biology of Water.
Okay.
And I think it's a great read. It goes through dietary therapies, different supplemental and herbal options for people, and even talks a little bit about mistletoe in this as well.
Okay. So how exactly, what is the, like we say, the mechanism of action with these different forms of mistletoe when it comes to a cancer cell?
Yes. So let's first start with like the science, I guess, the immunological profile. So when you administer mistletoe to someone, it has a lot of immune stimulation to it. It, like I mentioned, can cause a fever if you do sub-Q and then lead up with an IV. If you use higher lectin, sometimes mistletoe, host trees. And so it's bringing warmth when sometimes we didn't have warmth. Like some people that have cancer have a history of, being cold a lot. They had suppressed fevers growing up. And so this is kind of giving immunological competence again to those folks. It's also directly cytotoxic, meaning it's anti-cancer cell. So helping with apoptosis. It helps with different immunological messaging. So your body kind of is getting the picture that, hey, something's going on. Let's actually go after the cancer rather than let it just fester.
Yeah.
But then on an etheric side, like I kind of mentioned, it's bringing warmth. And there's a lot of people who will go through that high fever experience sometimes, and they'll come out the other side and they'll just say, hey, like I have a new understanding of kind of the issues that were really prevalent in my life, and I've kind of been able to let go of past traumas. And you kind of get that experience when you're able to pick the right host for that person. That host tree is kind of depending on maybe your body type, morphologically, what your constitution is as a person, what type of cancer it is, where it's at in the body. And so that's why it's important to work with someone who maybe knows about all 4 different companies and all of the different types of trees, and how you can even, do it in different forms. Like sub-Q is great, and most people should be probably on sub-Q, but then you can do like intratumoral, you can do IV, you can do bladder installations. There's lots of different options for mistletoe.
For each person, so it's customized for each person.
Exactly.
As it should be.
Yeah.
As it should be, because there is no one size fits all when it comes to, herbalism.
Yeah.
There is no one size fits all when it comes to herbalism and herbal therapies. When you're working with plant remedies that nourish and support you, then they should be tailored to your physiology. So a big question that people always ask is, will my insurance pay for this? And I think we both know the answer to that.
Yeah.
And then how much, what is the cost that people are looking at?
Yeah. So not covered by insurance.
Yeah.
But I do think in the larger scheme of things, it's probably, I'd say if you're doing subcutaneous, like $150 to $300 per month.
Okay.
And some people might hear that and say, oh, wow, that's a lot of money. But think about how much chemo or radiation or immunotherapies are. surgery too. I mean, that's pretty pricey. So if you're doing it and you're checking in, you know, I think it's a great option to work with a provider. It's not something I would say go do by yourself alone. But yeah, if you have a provider and you're working with them and you're spending $200 a month and you're combining a good overall foundation, I think you got a great strategy to go forward. So yeah, nothing through insurance, unfortunately, at this time, but there are people that are looking into that.
Okay, as we should be.
Yeah.
You know, we should be. There's so many options out there. And I feel like where we are, you know, here in the Midwest, you know, if it's not the latest and the greatest supplement or the new gadget, or a few years ago, everything was, you know, an essential oil was going to fix everything, or, you know, it's the latest homeopathy, you know, there's just all these buzzwords in holistic health all the time. But when you're actually working with a skilled practitioner who has put the time, the passion, the effort, the cost of education into these skills to actually make a difference in someone's life, that's who you want to be working with. That's who you want to be working with. And I love that you are bringing this here because it is so needed, you know, here in little Indianapolis, Indiana.
Yeah.
You know.
Yeah, I think it's great. I mean, it's a therapy, you know, and I don't use mistletoe with everyone. It's not for everyone. Sometimes we talk about different things. But it's one of those things that seems to work pretty well for lots of folks. And so I think it's worth having more of a conversation about. And like I said, yeah, there's very few providers that have gone through the training, and I hope that we get more and more of that, that we can network with each other. And that's a big passion of mine that, you know, if you're a provider, you're someone that's got a space, you're a practitioner and you want to learn more about this, you know, let's have conversations because I'm hopefully here to share this. I think it's something that needs to be shared and given as a resource to lots of folks.
Absolutely.
Yeah.
It is. It does need to be shared. And it does kind of blow my mind that more practitioners don't have this. So I'm hoping that conversations like this start to plant some seeds and people start to understand the importance and how to look outside of the normal standard of care. You know, there's just so much more that can be done with these integrative therapies to, as I always say, nourish and support you.
Yeah.
So where can people find you? Like around here, I talk about Aron all the time. He sees people at Georgetown Market. He also sees people at Materia Medica. So where, give people like your website, your Instagram.
Yeah, so people can follow me. It's Heartwood Herbals on Instagram, and then you spell it HART, Heartwood Herbals. The website's heartwoodherbals.com, so they can check that out. If people are interested in scheduling a consultation with me, they can email me. It's heartwoodherbals@gmail.com. They can send me messages on Instagram too. And yeah, if you come to Georgetown Market, you can pick up business cards. They can reach out and get my number.
He's on my website. Yes,
they can reach out that way too. But yeah, let's have conversations about it. I think, you know, giving people options is the best thing that we can do. And if people want to learn more about it, there's actually a free class at the end of the month.
Oh, awesome. Where's that going to be?
Yeah, I'll be at Georgetown. So end of the month on a Sunday from 2 to 3:30 p.m. We're going to go through mistletoe and lots of different options for cancer.
Awesome.
And yeah, it's a great way to just come out and learn and then have discussions. If people want to learn more too, we've talked about it on the Awaken Indie podcast.
Yes.
And so people can check out Awaken Indie on, I think we're on Spotify, Amazon, Google Podcasts, lots of different ones. Apple,
yeah. On all of them. You can't sit up here, buddy.
Just checking it out.
You can't sit up here. He always wants to sit on the couch.
That's right.
So I hope that this has been informational. I hope educational. I hope it's been inspirational. So just if you yourself or anyone that you know is dealing with that very scary C-word diagnosis, right? I just want people to understand that there are other ways to help to support you, to help you get through this. And these are old ancient ways, right?
Mm-hmm.
Very, very old ancient ways. And so it's not like it's just something that's new, right? So I'm just hoping that people know that there is hope out there. You know, we don't always have to go for the fear factor.
Mm-hmm.
There is so much hope out there from very, very skilled and talented people.
Yeah, I think one thing worth mentioning, you could maybe think about that, you know, like, don't feel rejected too if you're like, I don't want to do mistletoe or holistic options. I want to do surgery, chemo, radiation.
Mm-hmm.
You know, for some people, I've seen that work really well.
Yeah.
But at least come see someone that then can run like your cancer antigens and actually know, with some other lab work too, whether your chemo is actually going to work or not.
Yes.
You know, let's find out the pathways that work with your cancer, and see, yeah, which herbs, which chemo, which drugs, if you're going to go that route, actually work. Because most oncologists, they won't actually tell you if your chemo is specific to you.
Okay.
So we can even chat about that if that's an option that we want to do. So no matter where you're at in that journey, we can have a conversation.
Absolutely.
Yeah.
It's just so needed. The environment that we live in today, you know, like you said, the water, the food, the emotional states, the high stress, you know, there's so much out there that's against us that it's so needed to know what is out there in your environment also that is positive and supportive and that is actually for us. So thank you so much for coming in and sitting in my living room with Bodai, my very noisy dog.
No, I'm glad to be chatting with you, so thanks for having me.
Absolutely. We need more and more people out there sharing what they can do to help serve people.
Yeah.
Okay. Thank you, guys.
Thank you.